Hello, my name is Blanca Zavala and I will be doing my health assessment today on this lovely person. I will start off by washing my hands. Just give me about 15 seconds. Okay, my hands are now washed. Normally, I would probably wear gloves as well in the real clinical setting whenever you're doing anything with the patient, just as safety measures and precautions. Okay, I'm going to start today with the basics first. I will be taking his blood pressure first, as well as asking him a few questions. What's your name?
My name is GZ.
Okay, and what's today's date?
It is the 8th.
What state do you live in?
Virginia.
What month are we in?
December.
Okay, so the patient is alert and oriented to time, person, and place. When he speaks as well, his articulation is fluent and understandable. Okay, I'm going to be putting this on your arm. Okay, please make sure not to cross your legs. Okay, blood pressure is 112/80. Now I will take his temperature. I would normally take temperature orally in the clinical setting, but as this is my daughter's axillary thermometer, I would put it inside the shirt. Okay, temperature is 98.1. Now I will begin the rest of his assessment by assessing his hair, skin, and nails. Okay, hair is distributed evenly throughout his scalp with several tiny scars present. His skin color is even. No discoloration present. 2 tattoos are present on his arms. There's 2 nodules present, one on the left side and one on the right side lower to the nose. He has several nevi present among his face. Okay. Now his nails. Nails are normal. Nail beds are pink. No clubbing. Have you had any history of skin disease or any dryness, skin problems presently?
No.
Okay. Now I'm going to check his skin turgor. I'm going to pinch a little bit of your skin right here. Okay. Skin turgor is present. Skin shows elasticity and mobility. Now I'm going to continue this assessment with his eyes. I'm going to check his pupils for size. Okay. Do you have any visual problems? Any blurring?
No.
Have you had any eye surgeries?
I had eye surgery in February.
Okay. Okay, now can I have you focus on that object on the wall?
Okay.
Now my finger. Alright, pupils are round and equal, and they reflect to light and accommodation. Now I'm going to assess his ears. Does it hurt when I do this?
No.
Do you have any hearing problems, or do you feel any ringing in your ears?
I have sometimes ringing.
Since when?
About 9 years.
Okay. Is there something that might have triggered that?
Working on airplane.
Okay. So his ears are equal, bilaterally, and symmetrical. There's no presence of drainage in the ear, and no tenderness or swelling present. Okay, now I will be assessing his lungs. Oh, I'm sorry. His mouth, teeth, and gum. Can I have you open your mouth? Lower jaw, there's teeth crowding. Has a cap on the right side and several fills. His lips show no sign of crackness or dryness. His tongue is pink. Can I have you lift your tongue up, please? The lower side of his tongue is pink as well. No lesions present on the inside. No irregularities noticed. Okay, now I will be assessing his lungs. Do you have any shortness of breath?
No.
Okay. I will start by auscultating the front portion of his chest. Now have you take a deep breath every time the stethoscope touches your chest. Okay, can I have you sit the other way around? Now I will be auscultating the posterior side of his back in the same motion as I did the interior to compare each side. Take a deep breath. Okay, can I have you turn back around, please? Okay, can I just have you take one deep breath? Okay, his lungs are clear on all lung fields bilaterally. And his chest expands symmetrically. No effort. His breathing is effortless. And his accessory muscles are not used to help with his breathing. Now I'm going to be assessing your heart. I'm going to be assessing his heart and his vessels. I'm going to start by auscultating his apical rate. Are you feeling any chest pain, or have you had any chest pain recently?
No.
Okay. When auscultating his apical rate, you would normally auscultate it for 60 seconds, but for time purposes, I'm just going to show the placement. The placement would be on the fourth or fifth intercostal space, medial to the mid-axillary line. Okay, now I will be auscultating the different heart landmarks as well. Okay, and I'll be going back to demonstrate what Erb's point is. And Erb's point would be on the third intercostal space, just slightly left of the sternum. Okay. While I have him sitting up, I'm going to feel his pulses. I'm going to start with his pedal pulses, which I will lift his leg just to show. Okay. Both pedal pulses are present and they're normal. Now his radial pulses. Both radial pulses present, normal. I'm also going to palpate his carotid artery. Both carotid arteries are palpable. Now I'll be inspecting for jugular vein distension. No jugular vein distension present. Let me check. I'm going to check your capillary refill. Capillary refill less than 2 seconds. Now I'll be checking his legs for any swelling. Okay, no edema present on either of his lower extremities. Now can I have you lay down? Now I will be feeling for any pulsations, thrills, or heaves. I would do that by placing my hand where the apical rate, the apical impulse would be, which is fourth or fifth intercostal, medial to the mid-axillary line. Okay, can I have you just lean a little bit towards me? Can I have you exhale and hold it? Okay, no pulsations, heaves, or thrills felt. Now, while he's laying down, I will be assessing his abdomen. I will start by inspecting his abdomen. I'm going to lift your shirt up. Okay. 3 more tattoos noted. 3 more tattoos noted. Several nevi present as well. His abdomen is flat. And then I will auscultate before touching anything. I will auscultate each quadrant for 15 seconds, but for time purposes, I'm just going to auscultate real quickly. The upper right quadrant, upper left quadrant, lower left quadrant, and lower right quadrant. Okay, all vowel sounds present in all 4 quadrants, normal, active. Now I will palpate, and I will start with light palpation. I will fill each quadrant with my 3 fingers in a circular motion, just lightly. Okay, now I will do a deeper palpitation. Same way, just deeper. When was the last time you had a bowel movement?
3 hours ago.
Was it warm, soft, liquid?
Formed.
What color?
Brown.
Was it normal?
Yes.
Normal for you?
Yes.
Okay. Any pain or tenderness when I feel on your abdomen?
No.
Okay, so no tenderness present in any of the quadrants. Okay. Now I will be assessing his musculoskeletal system and his range of motion. Are you currently having any pain or weakness in your extremities?
No.
Okay. Right now that I have you laying down, I'm going to actually start testing your range of motion with your hips. So can I have you raise your right foot up with, keep your left one straight. Next one, do it with the other leg, please. Okay. Now with your right, I'll have you bend it towards your chest. Keep the other one straight. Okay. Now the other one. Alright, thank you. Now if I can just have you sit. Actually, I'll have you stand up now. We'll continue with the range of motions, and then I'll assess his gait afterwards. Can I have you raise your arms forward all the way as far as you can? Okay. Now bring them back down and then back. Okay. Now can I have you put your arms out forward in front of you midway, and can I have you flex and extend? Flex again and extend. Okay. Now I'm going to have you bring one knee up, bend it. Now extend and bend it, and same with the other leg. Okay. No pain when you do any of those motions? Okay. So patient shows full range of motion with no pain or no crepitus present. And now I'm just going to assess your gait. Can I have you walk in a straight line, toe-to-toe fashion? I mean, heel-to-toe fashion. Okay. Now can I have you stand once again? Can I have you have both your feet together and close your eyes? I'm performing the Romberg test. As you can see, he has a negative Romberg test, but normally you keep the eyes closed for at least 20 seconds, and if the patient is swaying or starts to fall to the side, it's positive, but my patient has a negative. And make sure to stand next to the patient to prevent any falls or injuries. And now for the last one, can I have you lift up your left leg and bend your right knee a little bit? Okay, same with the other one. Okay, so the patient can walk straight, heel to heel fashion, and he's able to balance, and he shows a negative Romberg test. Okay, this is the end of my health assessment. Thank you.